Hi, I'm Dr. Josh, and in this video I'm going to show you a really simple mobility routine you can use for a stiff or sore back. I use this myself if I've had a bad sleep, if our baby's woken us up in the middle of the night and I'm just waking up stiff and sore in the morning. I'll often use this to get moving. Combine this with a quick 10, 15, 20-minute walk and things are usually feeling a lot better. I frequently use this with patients who have a really sensitive back, so maybe not a super severe injury, maybe like a moderate strain, or perhaps their joint is irritated, like their lumbar joint or their SI joint, and this just helps to really calm things down and help them get moving again. So it's really nice. It doesn't need any equipment. It's a bit cookie cutter, but that's okay. Feel free to modify it. It's just a good starting point to try and get your back moving again. So you can do this on your bed if you're having trouble getting down to the floor, but basically you're going to be on your hands and knees. Plant those hands and then start rocking back and forward. Just trying to ease some motion into your back. Motion is lotion. That's how we get things moving. Start to tilt the head, drop the head, and just work further and further into that rocking as it gets more comfortable. Do that for as long as it takes, 30 to 60 seconds, and then start to arch up like a cat. Arch back the other way, and start to work that arching in your back. Both directions. This is your cat-cow for all you yogis out there, or cat-camel. And now you can actually start to sit this one back a little bit, all the way down to your heels, trying to arch out of each position. So you may notice I kept my arms planted the whole time, my hands planted on the floor, and I kept my elbows pretty much straight the whole time. It gets way harder when you start bending the elbow because you're putting a lot of weight on that shoulder and tricep. It's a great exercise, but we're trying to get the motion in the back for these. And then from here, we're going to do some rotation. So hand up on the head, rotate and rotate. You can do from that position, you can sit back and do the rotation as well. And you can do the other side. Same thing. And then usually I'll sit into child's pose at the end and actually do some stretching where you're reaching across, breathing the whole time. Combine that with a nice walk and your back should be feeling a lot better. Let me know if you have any questions.